Bronchiolitis. Pediatrics. Introduction. The bronchioles are very small tubes inside the lungs. Select true or false. Correct. Bronchiolitis affects only children. Select true or false. Correct. Bronchiolitis also affects adults and older children. However, babies and young children are affected more severely because their lungs and immune systems aren't fully developed. Bronchiolitis is contagious. Select true or false. Correct. Which of the following symptoms is more specific to bronchiolitis than the common cold? Choose one of the following options. 1. Fever. 2. Runny nose. 3. Wheezing of the lungs. Correct. Wheezing means that the small tubes in the lungs may be blocked by mucus and pus, which is more likely to be seen in bronchiolitis. Humidifiers can help loosen the mucus and make it easier to be coughed out. Select true or false. Correct. Vaporizers and humidifiers can help to loosen the mucus. However, steam and hot water humidifiers should not be used because hot steam can burn babies' lungs. You should call the doctor if your child has signs of dehydration. Select true or false. Correct. Signs of dehydration include sunken eyes, dry mouth and skin, tiredness, and little or no urinary output. The doctor usually gives antibiotics to treat viral bronchiolitis. Select true or false. Correct. Antibiotics are not good at fighting viral infections, so they are not usually ordered for bronchiolitis. Bronchiolitis is contagious. Select true or false. Correct. The viruses that cause bronchiolitis are usually found in nose and mouth fluids. Sneezing or coughing may spread the infection to others. Thank you for using Explain.